Number 7, caring for your skin. Very important. Even in sunny Syracuse, skin cancer is, hands down, one of the most treatable, curable cancers there is, if it's caught early enough. You know, have you heard the story in the news about Hugh Jackman? That actor, tall Australian guy, best looking guy in the world. Australian ideal of what a man should be. His wife was nagging him because he had a little freckle on his nose. That he was going to be a typical male patient and say, yeah, it's just a freckle, whatever. She kept on him about it. He had a little basal cell carcinoma, and he had it removed. And I think since then, they found another one. So when he used to be the bronze guy on the beach in Australia, now he's probably going to come out with his own line of fedoras and sunscreen, because it really does change your thinking when it hits close to home. And the best time to check, once a month, is when you first get out of the shower. When you're wet, look in the mirror. Everybody's got a mirror, they can look at their backside. I don't care who says they don't. I see that. But men typically get skin cancer on their back, and women statistically on their lower legs. Of course, people always notice it most when it's around the face and around the head. But again, just statistically, those are places to look. And if you've ever had a severe sunburn, I have a white patch on my back from when I was like 10 years old. I didn't know any better. First day of the summer, it was sunny at a friend's pool. I burned so bad I was peeling sheets. I was sick for a week.
Yeah.
So I've got a little white patch that never quite got back to normal, and I watch it like a hawk. So that's important to keep an eye on as well. Medications. Again, I'm with MVP Healthcare, and we have a program for our members in the different regions called a medication review. And people will fill out an intake paperwork, list their medications, and if they know why they're taking them, and then they'll come in, I'll review it with them, and then they sit down with a pharmacist who can go online and really one by one review their medications. I've had people come in taking 20 different prescriptions, and they might not necessarily know why they're taking them. And what's nice now is that the electronic systems are so good, real time, they can flag if there's going to be a dangerous interaction with a medication. Something they might not pick up on is if there's a redundancy. You might be taking a fish oil supplement for your cholesterol or for something else, and also be on cholesterol medication. So that's why it's always good to have that relationship, not only with your doctor, but with your pharmacist, to ask those good questions on a regular basis to find out, hey, if I can manage whatever conditions I have and take fewer pills, don't I want to do that? A good case in point, a couple of years ago, when my dad was having trouble, obviously with the Alzheimer's, it took about 4 years. He was also taking a cholesterol medication, and those of you who've taken different statins know that there are associated side effects. And he was getting muscle cramps and aches, and he was really having a hard time. My stepmother went with him to the doctor, another doctor, and really dove into it because she liked to keep him active as possible, so he could stay positive. And she kind of said, his cholesterol has never really been that bad of an issue, and at this stage of the game, something else is going to get him first. So why compromise quality of life treating something that probably isn't as big an issue as having a higher quality of life? So she weaned him off of it, and he was able to, go to the YMCA 3 days a week and swim, go out dancing. He had a better social life than me, which isn't saying much, but it was very important to ask those questions, to go in armed with those questions before you leave, especially if you have yet to find a doctor that really can sit down and take that amount of time with you that you'd like them to. Does anybody know how many prescriptions, statistically, a person is on that puts them at a significantly higher risk of suffering a fall?
3,
6.
10, 3.
You're all in the ballpark. They say about 4.
Oh, really?
Yeah,
Wow.
4 more prescriptions, statistically. But there are so many medications that can cause you to be off balance. And sometimes it's not the medication itself. If you're taking a diuretic, for example, for hypertension, you're losing a lot more fluid. You can become dehydrated. You become dizzy, so it's not the medication itself, it's the side effect of it and not managing what the medication is actually doing to your body. So again, driving those questions. Number 9, underrated, humor and a positive attitude. They did a study of physicians and patients. They interviewed the doctors and their patients and had them identify if they believed that their physician had a sense of humor and a positive attitude. And they asked the doctors themselves if they thought that they did. And they found that the physicians with a positive attitude and a sense of humor, they had greater productivity, they were better at problem solving, they were more efficient and more creative with their diagnoses. So make sure your doctor knows how to smile still. Although it's tough for them, I can understand what they must be going through these days. Something else that's important as far as a positive attitude, when you laugh. Laughter, they've done studies, 30 minutes of comedy a day can significantly help people who are suffering from chronic pain because it releases dopamine. It releases all those feel-good chemicals that we get from when we work out as well. Makes a huge difference. And I keep picking on my late father because he gave me such good source material for so long. But one of at his funeral, just this summer, my sister went up and did a little eulogy for him. Little talk, it was somber, talked about growing up, going to camp, our vacations that we used to take to Myrtle Beach every year. And everybody was getting very sad. I could just feel the whole church. It was packed. He was a very popular musician in town. And everybody was getting really down. And then I went up, and I'm thinking, just because you can make light of a situation doesn't mean you're taking the situation lightly. I mentioned to him, speaking of our trips to Myrtle Beach, the very first year we went down in 1975, my father took me and my sister to go see Jaws. It had just come out. And I looked over and I'm like, thanks, Dad. I didn't go in the ocean for 10 years. But it helped because it's the first thing that popped into my mind, and he had a good sense of humor, and it made a difference to, it was a very somber occasion, but you can only choose to react one of 2 ways. And if you can laugh about it, as we all might be falling on the ice in the next few weeks, as long as you're not hurt, and nobody sees you, like that poor lady who was texting and went into the fountain at the mall.
Oh my God.
First thing I would have done is laugh at myself and said, all right, get it all out, everybody laugh at me. That was a dumb thing to do, but I thought that was pretty funny. Does anybody know how many times a child laughs per day on average? Yeah, like they asked like 150 at least. Then they did the same study with a cross-section of adults, and they came up with 4.
Really?
Well, they probably have never been to one of your meetings. But it's important. It's important to really find humor in everything during your everyday life. De-stressing, stress affects everything. We're all about our endocrine system. We're all about glands and hormones. That you get one that goes out of whack, and it can be a domino effect. And it can affect everything. It can affect your sleep habits, which can affect your weight loss, which can affect your blood pressure. So it's really important. I mean, so many studies that have come out that stress is sometimes so overlooked. Making a stress list is a really important thing to do as well. Any of you keep a journal? You know the best thing about journaling? There's no wrong way to do it.
Yeah.
Keep a little notepad by your bed. They'll say if you can make a list of the things, the stressors that you can't control, and then on the other side, the stressors that you can control, and then forget about the ones you have no control over, and zero in on maybe one or two of the things that you can. When you write things down, they've proven that it can help alleviate some stress. And the little 4-4-4-4 thing that's in there, any of you who've taken yoga, it's pretty classic with that. I use it for when I can't get back to sleep at night. You breathe in through your nose for a 4 count. Hold it for 4 seconds. Exhale through your mouth for a 4 count. Do that 4 times. You can bring your blood pressure down, your heart rate comes down. Same kind of thing when you count to 10. If somebody's, especially when you're driving, if somebody's cut you off or you really want to reach out and touch someone, and you can say whatever you want because your windows are up, and you can just say it and they can't hear you. Or if they did, you can just say, oh, I was on the phone. My Bluetooth, I'll blame my Bluetooth. But taking a few seconds, because we all can choose how we want to react. And that little gap can make a big difference. And the last one, last but not least, the only one thing I'm going to say about tobacco is they've estimated that if they ever do eradicate it from society, it will go down in history as the worst cause of disease and death ever in mankind. More than war, more than disease, more than famine. It's just so far-reaching. I have a very dear, beautiful friend of mine from Syria who came over to escape the violence several years ago. And she came over, and her view of it was, nobody here smokes. When I look around, I'm like, there's a lot of people who still smoke. I see a lot of nurses that smoke. And people outside health insurance companies. But from her perspective, because everybody in the Middle East smokes, you can't open a restaurant without a hookah, or you're going to go out of business. But that cultural shift is so telling. It really makes a big difference, depending on where you come from. So, basically, in summary, slow and easy. All the clients that would come in to see me, the ones that said they weren't going to be a perfect client, they always did the best. The people who try to do too much too soon, they can't incorporate changes into their lifestyle. So pick one thing. Maybe one thing from the list. Maybe a list that you make up yourself. Pick one thing. Maybe this week you're going to drink more water. Maybe next week you're going to make sure you get your 5 servings of fruits and vegetables every day. Those little changes, and then you can always dial in a little bit more, especially this time of year. I don't want to rain on anybody's parade, or this time of year, snow on anybody's parade. So have fun, but from what I was hearing from Ellen, that it sounds like you all did pretty well this year for Thanksgiving. So I'd give you a hand if I had a free hand. So thank you very much for your attention.